Public-private partnership at RHC and THQ level is a flagship project of the Government of Sindh. It was launched in November 2016 to improve quality of health services in 20 districts of interior Sindh. Integrated Health Services is one of the leading national NGOs working in health sector since 1996. Having vast experience of health service delivery across the country, IHS was contracted as the implementing partner of the Government of Sindh. The contract was signed on the 19th day of March 2015 in Karachi. However, the actual implementation of the project started in November 2016 after a delay of almost 18 months. The delay was due to a major shift in the existing system with significantly different operational dynamics. The facilities awarded to IHS are spread over 20 districts and include 6 Tehsil headquarter hospitals and 105 rural health centers. The first phase of the project was launched in Larkana division comprising of 5 districts: Jacobabad, Kashmir, Larkana, Kambar, and Shikarpur. 22 RHCs and 3 THQs have been contracted out to IHS in Larkana division. RHCs and THQs are vital components of the district health system. By design, an RHC offers basic emergency maternal, obstetric, and neonatal care services with OPD services during day and emergency cover around the clock. Average indoor capacity of an RHC is 10 to 20 beds. Rural Sindh is mostly plagued with poverty. Many are unable to source decent meals for the day. Disease is common. Before IHS took over, most of the facilities were only functioning partially with no 24/7 coverage and poor infrastructure. The challenges for IHS were monumental. IHS first had to ensure 24/7 operations. Newspaper ads were released and the hiring process began, but it was not easy. Quality human resources were not available because of unwillingness to work in remote, rural areas. To facilitate, IHS offered provision of pick and drop services to the potential employees. The idea seemed to have worked out, especially for female practitioners.
मेरा नाम इरशाद है और मैं एलएचडी हूँ यहाँ पे। हमारे यहाँ जो 24 आवर्स की जो फैसिलिटी यहाँ पे स्टार्ट की गई है आईएचएस वालों ने, तो मैं भी आईएचएस के स्टाफ में से हूँ। तो यहाँ पे माशाल्लाह बहुत से पेशेंट आ रहे हैं, बहुत सारी सहूलियात यहाँ पे हम फराहम कर रहे हैं पेशेंट्स के लिए। तो पेशेंट जो है यहाँ से बहुत उनको फ़ायदा मिलता है। यहाँ पे मेडिसिन हम मुफ्त में देते हैं, डिलीवरीज वगैरह करवाते हैं, बहुत पेशेंट सेटिस्फाई होते हैं हमारे।
In most facilities, close to 60% government-employed doctors remained absent. The patients suffered, unattended. Through a structured survey, IHS found that around 102 healthcare providers were absconders, absent without intimation to competent authorities. Their records were on paper, but physically, they were non-existent. A list of these employees was shared with the Department of Health. Immediate action ensued. Some of these employees returned while search for those that haven't still continues. With adequate availability of healthcare providers, IHS now had to halt medicine pilferage and make certain the availability of medicines. Almost all health facilities were stocked out since months. Based on a comprehensive health facility assessment, IHS initiated procurement of medicines. Within 3 weeks, IHS ensured availability of almost all essential drugs in target health facilities. A robust supply chain system was put in place, and to ensure cost effectiveness, IHS introduced a customized medical logistics management information system. Medical warehouse and health facility based staff were trained to raise demand and expedite supply. The training was based on the principle of maintaining 20% buffer stock at all times. The infrastructure of the facilities was dreadful. It was not conducive for the delivery of quality healthcare around the clock. Lack of boundary walls and gates for security, choked sewerage system, non-functional toilets, broken doors and windows, lack of infection prevention and hospital waste management system, chipped walls, cracked roofs, and garbage in and around the facilities was a common sight. IHS undertook minor repair and renovation of the health facilities.
IHS के हवाले जो हमारे RHCs किए गए हैं, हमारे पास डिस्ट्रिक्ट में 4 RHCs हैं जो कि IHS के हवाले किए गए हैं। मैंने तकरीबन 3-4 विज़िट्स किए हैं मुख्तलिफ RHCs के ऊपर। काफ़ी इम्प्रूवमेंट है। थोड़ा बहुत जो रिपेयर एंड रिनोवेशन का काम था वो वहाँ पे कहीं पे हो चुका है, कहीं पे अभी भी काम वो जारी है।
The conditions have now improved tremendously. The once overcrowded hospitals now seem more organized and welcoming. With the infrastructure improved, it was time to focus on fixtures and medical equipment. Most of the medical equipment was damaged and the fixtures deplorable. IHS managed to repair all out-of-service equipment through an exclusively hired biomedical engineer. But these health facilities were still hosts to continuous power outages. IHS managed to provide electricity backup to all health facilities through provision of solar-complemented UPS and generators. Ambulances in most health facilities were off-road due to mechanical defects. IHS managed to repair a total of 17 off-road ambulances and strengthen the referral system in all 5 target districts. IHS now turned its attention towards capacity building and training. Several workshops were organized to provide basic training to the staff, and now most of these facilities boast quality healthcare for the people. With these improvements, the satisfaction levels have risen exponentially across the board, from patients to doctors.
IHS NGO in काफी इम्प्रूवमेंट है या 80% इम्प्रूवमेंट।
सही अर्ज़ इहो आहे असां शुक्रगुज़ार आहियूं। कंहिं ज़माने में हिन में का शइ कान हूंदो, डॉक्टर ड्यूटी ॾींदा हुआ, हुन में का दवाऊं कोन हुआ। अल्लाह जी महिरबानी सां उहे हर शइ दवाऊं ऐं ड्यूटियूं दवाऊं सभु शइ थी वियो। असां दुआऊं था कयूं उन्हनि खे त अल्लाह साईं इन्हनि खे वधाईंदो, इन्हनि जी इज़त ईमान बचनि दे ख़ैर कंदो।
These measures have strengthened the healthcare system, in turn giving considerable rise to the number of patients visiting the OPD, lab and emergency room, and seeking antenatal and postnatal care. Poor mothers no longer have to spend egregious sums of money to visit private hospitals. Instead, they receive better quality free services from IHS-operated facilities.
महसूस कंदा त हाणे अॻे दवायूं न हूंदियूं हुयूं, डॉक्टराणी न ईंदी, हाणे माशाल्लाह हर शइ रत टेस्ट करनि था, डिलीवरियूं कराइनि था, हर सहूलियत रत टेस्ट करनि था, डिलीवरी कराइनि था, डॉक्टर सभु मौजूदु रहनि था। अॻे असां ईंदा हुआसीं दवा न मिलंदी, हाणे दवा मिले थी, हर शइ थिए थी, हर सहूलियत है असांखे हिन अस्पताल में।
जो भी हमारे RHC हैं दोनों के वहाँ पर काफ़ी बेहतरी आई है। इवन वहाँ पर लेबॉर्ट्रीज इस्टेब्लिश हो गई हैं और पंक्चुअलिटी पर बड़ी ख़ास सफाई सुथराई और उसके अलावा मदर एंड चाइल्ड हेल्थ पर भी उसका ख्याल रखा जा रहा है। इसके अलावा दवाइयाँ वहाँ पर सब मौजूद हैं, अटेंडेंस वहाँ पर ठीक है और सबसे जो बड़ी बात है, जो इलाके के लोग हैं, जो पेशेंट्स हैं, उनकी OPD जो इन्हांस हुई है वो बहुत स्पीडी तौर पे बहुत अच्छी कारकर्दगी की वजह से वो बढ़ रही है। डेली बेसिस पर जब आप उसे असेस करेंगे तो महसूस होगा कि आपकी OPD जहाँ पर 55 थी वो 300 प्लस हो गई है। इसी तरह
To make it easier for patients to connect with doctors remotely via secure video link, IHS introduced the concept of telehealth through a software called Ring a Doctor. A pilot is currently being tested at Garhi Khudabakhsh, and soon all RHCs would host these facilities. IHS has a long way to go, but not without challenges. It faces resentment among government staff that would previously miss any number of days at will but now have to maintain regular attendance because of the biometric systems in place. The local administration was rather apprehensive towards IHS when it began, but the passage of time brought with it the results of IHS's performance. The local administration, thoroughly satisfied, now plays a crucial role in this steady journey to quality healthcare. The political will behind this project is strong, as the government itself is the flag bearer, and without the support of the government, success would be nothing short of impossible.
IHS ने जब टेक ओवर किया है लाड़काना में, तो उस वक्त बहैसियत डिप्टी कमिश्नर मुझे ही ये टास्क दिया गया था कि मैं जो हैंडिंग ओवर टेकिंग ओवर है चार्ज वगैरह को उसको विटनेस करूँ, उसको सुपरवाइज़ करूँ, DHO से और IHS के जो तमाम मामला हैं उनको सेटल करूँ। जब फार्मली आप लोगों को हैंडओवर हुआ है तमाम हमारी हेल्थ फैसिलिटीज़, उससे पहले काफ़ी ज़्यादा चीज़ों की शिकायत थी, जिसकी बुनियाद पे सिंध गवर्नमेंट ने डिसाइड किया कि अपने लोअर टीयर्स जो हैं BHUs और जो तालुका हॉस्पिटल्स हैं उनको IHS को हैंडओवर किया जाए, RHCs जो हैं उनको हैंडओवर किया जाए। RHCs की जितनी वर्किंग थी वो ढकी छुपी नहीं थी, उसमें हमारा मेडिसिन का फुकदान, उसमें हमारे डॉक्टर्स की प्रेजेंस, हमारे पैरामेडिक्स की एब्सेंस और हमारे जो लोअर स्टाफ है उनकी एब्सेंस जो है वो बहुत ज़्यादा इश्यूज़ थे जो डिस्ट्रिक्ट एडमिनिस्ट्रेशन में हमें देखने को मिलते थे, हम फेस करते थे। दूसरा, अवाम का जो एक ट्रस्ट लेवल था, जो एक डॉक्टर टू पेशेंट ट्रस्ट होता है, जो एक कोऑर्डिनेशन होती है, जो एक अंडरस्टैंडिंग होती है, उसका बहुत ज़्यादा फुकदान था। ट्रस्ट डेफिसिट जो है उसको कंप्लीट किया है, मैं समझता हूँ कि IHS ने। मैं दूसरे ज़िला के बारे में तो आई एम नॉट श्योर कि वहाँ पे क्या वर्किंग होगी, बट आई एम क्वाइट कॉन्फिडेंट इन डिस्ट्रिक्ट लाड़काना एज फार एज द वर्किंग ऑफ IHS इज कंसर्न।
IHS, while only in the 4th month of this 10-year-long project, has transformed healthcare immensely. In the time that remains, IHS seeks to bring public healthcare facilities ahead of private hospitals and clinics in the area.